What is somatic movement education? If you've got tight or painful muscles, posture problems, you've tried stretching or many other things, then stick around as this topic may just help you. Hey guys, it's Emily from the Shiatsu and Somatics channel, bringing you tips and information to support your health and wellbeing goals. In today's video, we're looking at what is somatic movement education. How does it work? How can it help? We're going to learn about this functional neuromuscular movement system that can create real change by reducing muscle tension, improving our posture, and allowing us to find ease and freedom of movement. Welcome to Somatic Movement Education. Oh, and don't worry if there's lots of new ideas, topics or terms coming up, as what we'll do is break each of these down in detail in future videos. You can subscribe so you never miss the next installment. Let's begin with the overview. What is somatic movement education? In our previous video, we looked at how somatics has come to be this broad umbrella term that describes many different therapies and modalities within it. And included in this are a lot that are movement-based. The area that I work in is somatic movement education. And sometimes you might also hear this called clinical somatics or clinical somatic education, even just somatics sometimes for short. And I get it that it can be a tad confusing when these are all used interchangeably. What to keep in mind is that in most practices, sitting behind it is training and lineages that influence the style of the practitioner. Somatic movement education describes a framework based on the work of the late Thomas Hanna, who founded Hanna Somatics, along with somatic educators such as Feldenkrais before him. It offers a system of neuromuscular, that's brain-body, movement education or re-education by using gentle, effective and specific movements that help reduce muscle tension and improve our overall posture and patterns of movement. Perhaps the key word in all this is education, as it's both a movement-based therapy and an educational process. The client is an active participant. It's done with you, not done to you. So this all sounds great, but what about my tight muscles? How will this actually help? Great question. When muscles are chronically tight, contracted, or holding on, then it's become a habit. It's unconscious and out of our awareness. Habits come about through repetition. Maybe we sit at a desk a lot or carry a small child on one hip, play a one-sided sport, or there's been an accident or injury where we had to adjust for a while. We might not know if the habit is helpful or unhelpful. We're probably not even aware it's happening until something like a little pain, discomfort, restriction starts to creep in. This is because it's happening on autopilot, in the background, sometimes all the time. And that takes energy and it's got to be tiring. So our first thought might be, well, because it's tight, let's try and stretch it. And a stretch might feel good in the moment, but it's not going to teach or create long-term change. Sometimes it can even make it tighter. As what happens when we feel the sensation of stretch is that a protective reflex is kicking in very fast at the level of the spinal cord, and it sends the message, contract, I'm protecting you. There's no time to talk about it, just act now. What we do in somatic movement education is the opposite. We take the time and we talk about it. We create a connection and conversation between the brain and the muscle or the group of moving muscles. And this happens through the sensory motor system. To do this, we engage a process called pandiculation. And we will look at some of these new topics in detail in future videos. But if you've observed a cat or a dog, you'll have seen this idea of pandiculation in action. They do this yawn-like movement when they get up to reset their system, and then off they go. It's very clever. And we kind of sort of do something similar with our own yawn-like stretching when we have been still or trying to wake ourselves up. What Hanna looked at in his work was the neurophysiology applying the principles of pandiculation to voluntary movement. and doing this in a way that engages the sensory motor part of our brain, our nervous system, and the kinetic chains that move our musculoskeletal system. Here is our education. We're learning or unlearning what contraction or tight really is, sensing and feeling, and then coordinating the motor or the movement of a slow release and discovering the full range, control, and potential of those once tight muscles. It's intelligent movement. As when a movement pathway is on autopilot, it needs a deliberate and conscious pattern disruptor, which is what pandiculation does. In his work to describe how habituation can occur, Hannah coined the term sensory motor amnesia, or SMA, and emphasized that it is a process that requires education rather than treatment, to learn or relearn what has been forgotten, the muscle memory. And so we will rarely focus on one muscle in isolation, as it's about recognizing that we are a whole, interconnected, coordinating system, the soma. It's just that sometimes the orchestra isn't always playing together or in tune. And it's a bit like that idea that the pain isn't always where the problem originates from. We need to take in the whole context. And so what Hannah did was to systemize movements or somatic exercises that correspond to our postural and movement patterns. These are universal or reflex-like responses to stress and life that goes with being human. We see how these postural patterns and habituated muscle imbalances can appear through the front of the body, the back of the body, and the sides of the body. And we will look at all of these topics in detail in future videos. And on their own, these patterns are neither good or bad, positive or negative. We need all of them. We need to be able to respond to life, to withdraw and protect through the front, to ready for action through the back, to shift our weight when injured on one side. But just as they serve their purpose in a moment, we also need the ability to come out of them or have the movement tools to offset and to find neutral again, to sense and feel a different possibility. And like all new pathways and change, it's going to require its own repetition because our habits and grooves are strong. They run deep. They may have developed over decades or be reinforced by our daily activities. Our habits are familiar, and because they're known, they are in some way comfortable, even if that creates a physical discomfort. And so here, learning somatic movements will become a gentle yet powerful way to reinforce, sustain, maintain, and improve our sensory motor pathways and movement patterns. I see somatic movements as an empowering tool, something that you can learn and use and take with you through life. Somatic movement isn't designed to take away or replace something that you already love to do. Rather, it's about allowing you to keep doing the things you love to do, or maybe used to do before pain and restriction arrived. So we've learned how those tight muscles have come about and stay about, and what needs to happen to create real change. This is all great in theory, but practice is even better. So how do you learn this? Well, here we've talked a lot about somatic movements, or somatic exercises as they're originally called. These can be taught and learned as a standalone movement practice, whether in person or online, in a group or private lesson. There's also clinical somatic sessions, which is where a trained practitioner is able to offer hands-on techniques along with the movement exercises. This is tailored to the individual in a one-on-one setting and will typically focus on one postural pattern or presentation at a time. The movements will then become important self-care and reinforcement in between sessions. A clinical session will generally take place on a special low table and the client remains fully clothed throughout. The movements alone are great. It's self-pandiculation. The clinical work just takes it to a deeper level with hands-on assisted pandiculation. This can help accelerate change and learning, And working with a practitioner means they're tailoring the session and pacing and volume of learning to your needs and nervous system. No matter how many times I will let people know that this is a lot of brain work, clients are always surprised at how much brain power is involved. So we've covered a lot in our overview, and we will break down some of these topics further in future videos. But to sum up, somatic movement education describes a system of neuromuscular or sensory motor training that helps to reduce or offset chronic muscle tension, improve our posture, and bring awareness to our movement patterns and habits. It offers an alternative to stretching by using pandiculation, and it's a process of active and engaged learning rather than a passive treatment. And it gives you empowering movement exercises or tools that you can take and use through life. And I think it's always hopeful to have a possibility to create real change or to sustain, improve, and understand from the inside out, to find ease of movement wherever we're at. Thanks for joining me here, and I'll see you in the next video.